Hi, everyone, and welcome to our special World Diabetes Day live session brought to you by Policybazaar.ae. And today we are diving into a very prevalent condition around the world, which is diabetes. And nowadays we see people across ages being affected by it. Joining us today is Dr. Geethu Antony. She's a specialist in endocrinology from LLH Hospitals. Welcome, Doctor.
Thank you.
So, Dr. Geethu, I've come across this common understanding that managing diabetes doesn't have to be restrictive. It's about making informed choices that really, support our health in general. A consistent, balanced diet or rich in whole foods can probably help us in maintaining the energy and stabilizing the blood sugar and also prevent complications. I would like to dive deeper into this to understand it better with the facts. And I would like to begin at the basics because awareness really starts with understanding the basics, right? So, doctor, for someone who
And diabetes is called type 2 diabetes. So, and it's mainly related to the lifestyle change
Hmm,
called a lifestyle disease.
understood. That is very simple to understand and also very much needed. I feel because in general, when we talk about diabetes, a lot of confusion. People don't know. Also, the numbers around diabetes are staggering. Why do you think the cases are rising so fast, and what's so different about diabetes affecting people in today's time?
Yeah, so we know diabetes is called a global pandemic. And whenever we talk global pandemic, we are talking about two diabetes. So, say type
Hmm,
diabetes or there are various rare types of diabetes, relatively less common and the also remains the same. The type 2
hmm,
diabetes is rapidly all over the world, and it's predominantly because
hmm,
of the change in their lifestyle. So, as we know that the people who are over and obese are increasing because of the change in lifestyle. So, change in people are less physical active or less moving nowadays, and also there is a dramatic like with eating out, too much sugary food, etc. And stress, lack of sleep also has a huge impact on incidence of type 2 diabetes. And it's also closer to overweight and obesity. So whenever you are overweight or obesity, amount of
hmm.
fat in your body is significantly high, it leads to and because of this resistance, the type 2 diabetes happens.
Understood. Out of the first thing which you mentioned earlier, you mentioned the term insulin resistance. So does it mean that type 2 diabetes, it means insulin resistance, or is it actually two separate things?
Insulin resistance is a precursor of type 2 diabetes. So I would say that it starts with insulin resistance, and then that stage may not have diabetes. Then it leads to pre-diabetes, the
Hmm,
borderline, but not into the diabetic. And then finally, you have type 2 diabetes, where again you will have insulin resistance, glucose levels starts to becoming high, so that your insulin is not able to
hmm.
control the glucose, as I said in the beginning. That is a stage of
Un-
diabetes.
Understood. Very clear. Very clear. Doctor, these days, we see a lot of young people also being affected by diabetes. Now, for someone who doesn't have any history of diabetes, for someone who's in the family, nobody has been diagnosed. It's even difficult to even think that one should really check this, right? So, what could be the symptoms to look out for, which could indicate an onset of diabetes or pre-diabetes, for that matter?
The most common symptoms of, I would say, hyperglycemia or high glucose levels in your body includes you can feel
Mhm,
excessive thirsty, go to loo frequently, you can have excessive
mhm,
urination, or sometimes explain weight loss. You can be an overweight or obese patient and you lose like 10 kilograms without any lifestyle change. These are symptoms of diabetes. And also some patients present with recurrent skin infections, urinary tract infections. Whenever
hmm,
these symptoms are there, when you meet a doctor, and that is one of signals of sugars. What happens many times is that all these symptoms happens when the sugars are significantly high, not early stages of diabetes. If you are at higher risk of diabetes, then you should have a routine monitor of your blood glucose. And the age, previously we used to say that you can start monitoring after 40. Now I say that you should start early as 10 years because the incidence in teenage also. And if you are overweight or obese, you have a pot belly, that is your abdomen, the weight difference is
Yeah.
bigger than the other body parts. If you have a family history of diabetes, especially from an ethnicity where the incidence of diabetes is in Southeast Asians, Indians, Africans, etc., you should start for diabetes at a way. And in especially again in women, they have history of polycystic ovary disease. Again, you are at high risk of diabetes. If you had a history in your pregnancy, then also, and you should start routine screening from an early age, maybe 20s.
Understood. Understood. And briefly, could you just clarify, how does diabetes affect people differently from kids and teens versus adults versus older
Yeah.
individuals, or is it all same now in this time?
So as the type of diabetes differs in children and adults. So still
Mm-hmm.
the diabetes, that is the insulin deficiency, not the insulin
Mm.
resistance, that is more common in children, say below 15 years. And there
Okay.
are other rare conditions. There are rare causes of diabetes that's common in children, which since birth, but those are very rare, less than 1%
Oh.
of the total diabetes. So one is still more common, children. Type 1 diabetes, since it's insulin deficiency, the pancreas doesn't produce insulin at all. So the
Hmm.
patient will be on insulin from the diagnosis to life.
Yeah.
And it's a very different,
Understood.
we have to give them multiple insulin injections, insulin pump, etc. Whereas whatever the type 2 diabetes is very common, the common diabetes in adults. And
Mm.
probably the main difference is in when it comes in adults, the associated complications are also like
Mm.
if you are diagnosed with diabetes, you can have cholesterol, high blood pressure, and also you are at higher attack, stroke, etc. These complications are not seen in children at an early age. So this is the main difference between type 1 and type 2 diabetes, which are only approved above 18 years. Some
Mm.
we can't use all the drugs, even if you're diabetic, we got drugs in under years. So these are the predominant.
Interesting, very interesting. And so, when we talk about these two factors, I would say diabetes being genetically there, a genetic versus lifestyle driven. What percentages would it be if you have to put a figure to it?
Okay, so we can't put a figure. So, so two diabetes. Again, type 1 diabetes is different. It is autoimmune. It's an autoimmune condition. Like
Hmm.
we all know about thyroiditis or autoimmune thyroiditis. So it's an
Yeah.
autoimmune condition where the body produces insulin. So
Hmm.
that is type 1. So in type 2 diabetes, the
Hmm.
common diabetes macros, that is a mix of genetics and life. So say
Okay.
that it's a 50-50, and the important thing is that genetic modifiable. We can't change our genetics. So say if grandparents have, then you are at higher
Hmm.
risk of diabetes. So we can't ignore that.
Hmm.
So you will at some you might get diabetes if your parent, but life something which is so. Say if a man with 30, if his both parents are diabetic at 50 years, lifestyle is bad, then he will diabetes at 30. But if his lifestyle is good, then he can onset of diabetes maybe 50, 60, and sometimes you cannot get it. So
Mm.
I would say very important type to diabetes, but we can't do anything about it. Is something which is also equally important, maybe more important than genetics, and also it's all can take control of.
All right. So, is it safe to say that if a parent or grandparents they've had type 2 diabetes in their elderly
Yes.
age, and the child when he's growing up, he or she, if lifestyle is taken care of, if there are the precautions done and exercises or whatever it is to be done, uh, this onset passing through genetic tract can be avoided maybe.
Yes, it can be avoided or delayed as long
Delay.
as possible. So it again depends upon the genetics. It's a polygenetic disease. There are a lot of studies, but at the data is not very clear.
Mm,
So there are limitations till now. So we can't say that this patient might have a higher risk than the other patient. But then
got it.
lifestyle is something which will delay the onset of diabetes.
Got it. For sure, for sure. All right. So before we move into the next segment, just last question. So these days, 30s and 40s, people get to know that, hey, I'm pre-diabetic, and then there's a panic. So what steps can such youngsters take to prevent turn from that pre-diabetic stage turning into a type 2 diabetes?
So pre-diabetes, again, it's the stage between normal glucose levels and diabetes, where your sugars are in the border, but you are not a diabetic.
Hmm.
So first thing I want to focus is that pre-diabetes is completely reversible.
Hmm.
So you have to on your one lifestyle modification to
Hmm.
bring back the diabetes anemia. So in
Okay.
simple words,
Hmm.
when we see the 3 months average of your blood glucose, between
Hmm.
5.7 to 6.4 is, and more than 6.4 is diabetes. So
Hmm.
when it's between 5.7 6.4, depends upon your lifestyle, you can go either ways, either above 6.4 or below 5.7, depends on
Hmm.
lifestyle. So first thing is, if you're overweight, the reduction of around 5% of your total body will help in of that pre-diabetic stage,
Hmm.
normal glucose stage. So that the most important things are ahead, a regular exercise, and also we can't deny the importance of uh,
Hmm.
avoiding stress as much as possible. So around 7 to 9 hours of sleep is the ideal sleep. Anything less or more can lead to uh, diabetes or any lifestyle diseases. And stress, chronic stress in terms of mental and physical stress, is also an important factor which we all ignore.
Hmm.
That's and lifestyle, when we talk about lifestyle, healthy diet, and also exercise at least 30 minutes 5 to 6 days a week is very important
Hmm.
in preventing the pre-diabetes or making it back to
Hmm.
normal glucose. And when you are diagnosed with pre-diabetes, you should change, make the lifestyle changes. Also, you should screen periodically whether your glucose levels are becoming normal or it getting high. Another important
Hmm.
factor is to look for other diseases like high cholesterol, high uric
Hmm.
acid, blood pressure, and
Hmm.
sometimes when you have to also check whether you are at higher risk of a heart attack. So that's
Hmm.
also very common nowadays in young, especially in young males. So you have to assess yourself whether you are at higher risk of a heart attack also.
Understood. Understood. So pre-diabetic is the marker, I would say, which should definitely put all the radars
Yes.
up and be careful. And knowing the fact that this is absolutely reversible, and so it's just minor changes and tweaking in the lifestyles and in the entire food habits and everything, like you said, which can keep us safe. All right. Thank you so much for sharing that information. And now this is the segment where we say fact or myth. Okay, so I'm gonna ask you some really quick questions. This is collected from a I would say consolidation of ideas and questions that generally people have. You can just answer briefly, fact or myth, and if you want to maybe explain, you can feel free to do that. So one of the most common things we hear is eating too much sugar causes diabetes. Fact or myth?
Yeah, I would say it's a fact and a myth,
Okay,
because
why
if
is that?
you consistently eat a lot of sugar, you are at higher risk of diabetes, but that alone does not determine the
Okay.
diabetes. So it's a total unhealthy lifestyle, including physical activity, stress, everything
Yes,
as a
yes.
whole leads to diabetes rather than eating a sweet per day.
Got it. Okay. So some believe that once you have diabetes, you can never eat sweets or fruits again. Fact or myth?
It's a myth. You can, but you have to control the amount of sweet you are taking and what else you are
Mm,
taking along with the
the sweet.
sweet.
Yes,
So
absolutely.
maybe eating a gulab jamun or a laddu once a while is fine, especially
Okay.
on festivals.
And especially if you can offset that with some nice, like healthy living and whatever it is.
Yeah. So you have to compensate for that.
Compensate for that. Yes, absolutely. Here's another one. So if you're not overweight, you can't get diabetes. Does this mean like slim automatically just means that you're safe?
It's an
Myth or
absolute myth.
mm,
So it's an absolute myth. So the definition of obesity itself is little confusing. So it's not entirely depend upon the BMI. It
hmm,
depends upon the amount of fat in your body. That's a visceral fat, fat inside your body, not the
hmm,
below the skin. So it's called visceral fat. And
yes.
if that percentage is high, then again you are actually obese, not
Mm,
in the looks but in medical terms. So
absolutely.
you can be very thin and have higher fat percentage, which
Mm,
again increases the risk of insulin resistance and diabetes. So you
mm.
should get your fat percentage also checked.
Wow, interesting. I'm sure that that's gonna shock a lot of people, but it's very
Yeah,
important to
it's
know
very
that.
common among Indians to have
Yes,
you
absolutely.
can be thin but you can have a lot of fat.
Yes, absolutely. All right. So many think that diabetes is only a lifestyle disease, not genetic. And I think you have already bunked it. You've debunked it. So it is understood clear that it can be genetic and it can also be lifestyle only, even if there is absolutely no role of genetics. Is that correct?
Yes, yes.
Okay. Okay, great. Some say once you start insulin, you'll be dependent on it for your lifetime. Is that always the case, or can treatments or treatment plans can change over
Yeah,
time?
it's again a myth. As I said, in type 1 diabetes, we have differentiated between type 1 and type 2 earlier. So in type 1 diabetes, they are insulin dependent. So they have
Mm,
to be on insulin
yeah.
lifelong. So it's
Mm,
a different diagnosis. The doctor, endocrinologist or a diabetologist can makes the diagnosis at the beginning. And if
okay.
you are a type 2 diabetic and if you are put on insulin, the
Mm,
insulin can be stopped, and it
got
depends upon predominantly based upon the lifestyle changes which you make or why the insulin was started. Sometimes it start get started or some the patient on insulin for a short duration. So people are
indeed.
generally scared of taking insulin because they feel that it's going to be there with them, but it's
Mm,
not like that. You can always stop insulin in type 2 patients, but under a doctor's guidance.
for sure. For sure. Understood. Great. So now we have received a few questions from our viewers, and I would like to take a few of these questions so that you can help them understand.
Yeah.
Um, One again, we have discussed this, but I'll put it up there. Can diabetes be reversed completely with diet and exercise?
Yes, it can be. So a weight reduction of around 15 percentage of your total body weight, that is if you're 100 kg, a 15 kg weight loss will can reverse diabetes.
Wow.
And
Okay, but that's only in
but
type 2 or type 1 as well?
it's only in type 2. So type 2, not in type 1. Type small proportion. If you have patients, only one will be type 1 or even less than one. So type
Mm,
2 is what we
yeah.
commonly discuss. So it can be reversible when there is significant weight loss in a healthy way, that the body fat also comes down, not the muscle mass. And
Correct. Correct.
yeah,
Yes. I think many people have this misconception that when you say weight loss, they want to just go on an overall
yes,
weight reduction. They don't even care about muscle loss is happening, or is it just the fat. So I think it's a
fat,
balanced approach to that, again, under the guidance, right, of a specialist. Or
yes.
right. What's the best way to handle sugar cravings when you're diabetic?
So, sugar cravings, you should understand the reason for your sugar cravings, whether it's a stress eating or whether your sugars are going down. That's why you are having a sugar craving. And also, sometimes when you are not eating enough, you can have
Mm,
a craving. So I think most common is the emotional eating, which is considered as a craving when you are upset or something, you crave for sugar. So mental health is very important and you need to take measures for that. Second is to eat regularly, don't starve, eat a balanced meal,
mm,
which is good to eat also. So sometimes people put themselves through a very, what do you say, non-tasty meals, and which is lot
mhm.
of, which we
Yeah.
don't like. So that's something, then at the end of the day you end up eating a lot of sweets. So you have to have a balanced, palatable, nice food, which
Mm,
contains the carbs, proteins and fat in the proportions which is required. And
mm.
when your stomach is full or you won't feel hungry, then the cravings also comes down.
Of course, of course. Yes, indeed. Another one, very commonly heard: are fruits safe for diabetics, or should they be avoided?
uh, fruits should not Fruits can be taken, but there should be some limits to fruits. So what we generally say is 1 or 2 portions of fruit per day. And when you take a sweet fruit like mangoes or banana, you have to be careful. So
Mm,
whatever we see in India, whenever there is a season for mango and jackfruit, all my patient sugars goes up. The next time when they come, the sugar is 200, HbA1c is 910, because it's plenty, they
yeah,
eat in excess. So that
yeah.
should be avoided. But you can definitely take fruits daily, and
Mm,
fruits are an absolute essential with respect to the vitamins and minerals, and it should be taken. But the portion and the type of fruit does matter.
okay. So whole fruits versus fruit juices, even if it
I
is
think you
special.
know the answer: whole fruits, no juice.
Okay. Is there a
Because
particular reason you would like to elaborate on that? Because many people
yeah,
would
so
not
one is that,
understand why.
yeah. So one is that, see, you are losing the good things from the fruit, the fiber. So we are taking fruits and vegetables, and fiber comes from the predominantly in our diet, and fiber is
Mm,
very important for your bowel movements, for reducing the risk of cancer. There are a lot of good effects of fiber, and the
mm,
fruits are one of the important sources of fiber. So when you're taking a juice, the fiber is gone from there, so that benefit is gone. And also because of the loss of fiber, the glucose peak which happens with the juice is much higher than a fruit. So say
got it.
if you're taking an orange versus an orange juice, the spike of sugar which we see is very different. And
Mm,
also, to make a good orange juice, you need at least 3 oranges, which again increases the calories, etc.
of
And
course.
absolutely store-bought ones have a lot of sugar,
Mm,
so that again is totally unhealthy.
understood. Understood. All right. So, and then how often should one check their blood sugar if they're borderline diabetic? That's another question.
Yeah, so I would say that every 3 months. So we can check your fasting sugar, your post meal 2 hour sugars, that, and also the average sugar
Hmm.
HbA1c. So that can be checked every 3 months.
Okay.
So that's the routine.
Uh,
And also you should, other important thing is to look for other diseases like high cholesterol, high blood pressure, uric
hmm.
acid, fatty liver. So these also has to be done on a routine, because all these diseases comes together. When you are at higher risk of diabetes, you are at higher risk of cholesterol, blood pressure, fatty liver, everything.
Hmm. It's all sort of like a dominoes effect,
Yeah,
so
it's
it's
all comes under the
Connected.
umbrella of lifestyle diseases, and everything has an if the precursor probably is insulin resistance in a lot of these diseases.
Understood. Okay. And the next question is, what are the key pillars of diabetes management in terms of diet, exercise, and medication?
Yeah, so I would say that everyone should have a lifestyle, healthy lifestyle. Whoever is diabetic or pre-diabetic should follow a healthy lifestyle. So that
Hmm.
can bring about, if you say, around 1 to 2% of reduction in your A1C.
Hmm.
And if your sugars are not controlled with lifestyle, then you need medicines.
Okay.
Or if your sugars are significantly high at the time of diagnosis,
Hmm.
then you might need lifestyle with medicines. So the
Hmm.
main misconcept is that when you go to a doctor, they will give you medicines and you have to take it. So even the doctors will recommend a lifestyle, and if you are able to manage your diabetes with lifestyle, the doctor is happier than the patient. That's what I feel.
Understood. Absolutely.
Yeah.
Absolutely. Next question is that many people find it hard to stay consistent, checking sugar levels, sticking to diets, taking medications. So, is there any practical advice that you can share on how to stay motivated?
So, one is see, with regard to lifestyle change or diet and exercise, you have to choose a regime which is fit into your day-to-day activities.
Hmm.
So, if you are a like a South Indian who likes to eat rice, you can't go for a diet which doesn't contain rice, because that you are going to stop it because you love your rice and you have grown up eating that. So
True.
the diet should not be very different from what you used to eat,
Hmm.
and also it should not be very different from the diet of your family. So you
Family.
can't cook separately for
Yeah.
you or for another person, like for your husband, father, mother, etc. So it has to be a diet plan which has to be incorporated in the family, and it should be made with pertaining to a cultural context also. So that's the sustainable diet on a longer term. And similar with exercise also. So you have to incorporate, sometimes if you are busy, you don't have time to exercise, you can do small measures like climbing down the stairs of your
Hmm.
office 10 times a day, walking around, helping somebody do some household work. That's also physical activity, not alone
True.
going to gym.
True.
So
True.
in
Absolutely.
that way, if you incorporate the lifestyle into your day-to-day activities,
Hmm.
it makes you feel happier, it's sustainable and keeps you motivated. As far as checking is there, I think that uh, if you're doing all the lifestyle, everything correctly, I think you want to know how your sugars are behaving. So you naturally go for a checkup. But people who are on insulin, some people have a fear of checking because of the pain of pricking. Then there are
Hmm.
new devices available like a continuous glucose monitoring systems, which is, if you can afford it, it's very good to use.
Okay, okay, that's great. Okay, so the next question is, how important is mental health and stress management while dealing with diabetes?
Okay, so it's a double-edged sword. So if you have a mental health mood disorder, or if you're taking medicines for a mood, for any psychiatric complaints, the chances of being overweight and also diabetic because of the medicines is very high.
Mm-hmm.
And also when you have depression, generally depressive symptoms, there is changes in your neurotransmitters in the brain which can also have an impact on your insulin resistance and weight gain, etc. And
Hmm.
also diabetes per se, because it's a chronic disease, it comes with lot of other lot of implications in your life with respect to the medicines, the doctor visits,
Hmm.
other restrictions. It can have an impact on your mental health also. So keeping yourself motivated, taking help, professional help whenever it is needed, is very important. Sadly, in most of the health systems, mental health is neglected. Stress is also neglected.
Hmm.
But we have to, as say, uh, doctors especially, we have to, and policymakers also have to focus more on mental health to be
Got it.
incorporated into the healthcare management.
Okay, interesting. The next question is about continuous glucose monitors or insulin delivery systems. So, what are some of the latest advances in diabetes care?
So for diabetes, we have insulin pump is available.
Hmm.
So the initial insulin pump is where you attach a device to your, like the size of your phone or lesser size, to your tummy, and through a small needle, and you the insulin is delivered continuously. So previous pumps were not very great with respect to how to decide the dose. There were no algorithms, so it was manual decision to check your sugars and then give the injection, press a button and give the injections. Now we have more and more newer advances of insulin pumps available, where the pump itself through the algorithms calculate the amount of insulin patient needs and delivers it. So it's
Hmm.
very good in type 1 diabetics, and also in type 2 diabetics who find it difficult to control their sugars with insulin.
Hmm.
It's not require it's a pump is something which delivers the insulin, so it works like a pancreas. So when the sugars are high, the pump will give more insulin. When the sugars are down, the pump will give less insulin. So it has a lot of alarms for low sugar, etc. So that is main technology, which is again each year or every 2 years they are bringing more and more pumps, newer modifications, and with the artificial intelligence and all, we are getting very good pumps, though it comes as the price is little high for mostly, and
And
it's
and and
difficult to
are
power and yeah.
are these painful or because these?
No, it's like insulin injection. When you inject, it's a small needle is there, so when you inject it, it can be painful. Then for the monitoring, we have the sensors,
Hmm.
CGM or FGM. We have few devices like Libre, Dexcom, etc. are available, which will continuously monitor your glucose. Again, it can be used for at a stretch for 14 days. So again, you can avoid the multiple pricking of sugars. So these are the advices, and then we have a lot of other devices where, like watch and phone, which
Hmm.
detect your glucose levels. But those devices are not till approved by the medical bodies, so it's not been recommended by the doctors because the
Understood.
accuracy is always an issue.
Yes, indeed, indeed, absolutely. So, just two more questions. How is telemedicine helping patients manage diabetes better today compared to before?
Yeah, so telemedicine generally, when we see the patient, even if you're seeing the patient as an outpatient in your clinic face to face, the follow ups can always be done as a telemedicine call. So
Hmm.
you can have better connectivity with your doctor and the team of nutritionist, diabetic educator, etc., through
Hmm.
telemedicine. And also, whenever we are asking the patient to go for a health, lifestyle modification, lose weight, it's
Hmm.
always easier to monitor through telemedicine. So I always recommend my patients to
Hmm.
get in touch with a dietitian who has an online telemedicine facility, so they can be on a touch on a day to day or even a hourly basis.
For sure, for sure. Interesting. All right. So the last question that we have here is how important is it to have regular health checkups and insurance coverage for chronic conditions like diabetes?
Yeah, it's I can't stress the importance of having that. So as I said, the diabetes, the type 2 diabetes is becoming more and more common in younger people.
Hmm.
And also we are seeing more and more complications of diabetes, like a kidney problem, a heart attack, a stroke,
Hmm.
etc.
Hmm. Hmm.
So regular monitoring and keeping your sugars under control is absolutely essential, because
Hmm.
it will prevent the onset of complications of diabetes. Other thing is that as per the insurances, you have to include pre-existing conditions like diabetes, hypertension in your insurance. And if you're taking your insurance at a younger age, and if you get diabetes later, I think the premium, there is a difference in that. So to have a
True.
medical insurance from the beginning is very important. And if you don't change the insurance, then all this will be uh, covered in that. So it's very important because there are a lot of unexpected complications with respect to diabetes, hypertension, etc., and many financial balance of the family and leads to a lot of financial strain, etc. So, which can be avoided by having an appropriate insurance for a chronic conditions.
Understood. Understood. Well, great. But this has been a great, very insightful discussion, Doctor. And thank you so much for sharing your time and especially your knowledge and experience with us. And before we wrap up today, if there is one key message that you would like our viewers and everyone who's online today to remember about diabetes prevention and care, short message,
Yes.
what would that be?
Yeah, so the old proverb of prevention is better than cure. So you should work hard to prevent diabetes in your life because the treatment is always worse than getting diabetes.
True, true, true. Absolutely. Great. And one healthy habit that you think everyone should start today to just reduce the risk of diabetes altogether.
I'll say an unconventional habit. You should sleep for at least 7 hours a day and sleep schedule. No late nights and or late nights.
Well, that's a very difficult one that you've given, but let's see how many of us are able to implement that. And well, thank you so much, Dr. Geethu, for joining us today and helping us understand diabetes even better. And to everyone who's watching this, remember that awareness is the first step towards prevention, right? And like Dr. Geethu reminded us, that prevention is better than cure. So get your regular checkups done, stay active, keep yourself covered with a good health insurance plan, and don't forget to get yourself a health insurance from Policybazaar.ae, and you can check plans starting at just 4 dirhams per day on our platform. So feel free to go browse, search, and get yourself covered. Until next time, stay healthy and stay care. Thank you very much.